Brought to you by GTA. We start with you.
The best practice is to treat the patient as if they have COVID and not try to prove otherwise. And it's almost comical that it's even a question here. Stated Department of Public Health and Social Services Chief Medical Officer Dr. Felix Cabrera. He testified for over 2 hours this morning in Shauna Camacho's case against the agency he heads. Cabrera stood behind his reasons for keeping Camacho and her children, who are deemed as close contacts, in home isolation, despite the mother believing she had a false positive COVID-19 test. As stated in court documents, Camacho received a rapid ID Now COVID-19 test from a private clinic on February 25th. The results returned positive. The same day, she went to another clinic to receive a PCR COVID-19 test, and the results were negative. Camacho had a second PCR test just about 4 days later, and it was also negative. Although Camacho was required to self-isolate at home, and as a result, she has been unable to return to work as a public school teacher, and her 4 children are also stuck in home isolation. Camacho is challenging this requirement. Her counsel, Assistant Public Defender Brian Eggleston, argues that DPHSS has not identified any basis for the self-isolation order, other than the first rapid test result, and that his client is not infected with COVID, having no risk of transmitting the virus to others. Camacho was released from isolation last week, although her children have yet to be. The court questioned why the children's isolation period restarted on March 4th, when Camacho was released by public health and not when the mother first received that first COVID-positive test. Cabrera testified that Camacho could potentially still have been infectious and they don't know when the transmission could have occurred, in which they have to wait until she is no longer infectious to determine no further exposure to close contacts. During Cabrera's testimony, it was learned that there is a 0.0019% chance for a false positive, and he could not definitively say Camacho's case was a false positive. The respondents closed this morning with asking the court to continue to uphold DPHSS's policy of 14-day quarantine for any close contacts, as they have in the past with these consolidated cases. Assistant Attorney General Janice Camacho arguing the government has met its burden, that in this case home quarantine is the least restrictive measure. On the other side, Eggleston closed with pointing out that the court can only uphold the quarantine of these individuals unless it finds the rapid test results were correct and the PCR tests were false negatives. Eggleston arguing the burden has not been met and there is no other reason to not treat the petitioners as any other randomly selected member of the population. The court is taking the matter under advisement and plans to issue a decision in order.